Tonight's show, we want to welcome back Dr. Seth Resnick, the Chair of Psychiatry and Behavioral Health for Advantage Care Physicians. Thank you so much for being with us here again.
Thank you again for having me, Jessica.
And I know we saw you last month. We were at a different time then, and we were so grateful to have you as we really got into the thick of this. But, you know, we're at a different point now. For a lot of people, it's been more than 2 whole months of sheltering in place. Many people have gotten sick. Many have lost loved ones. And for people that are really starting to feel it now mentally, what's your advice for them?
It's a different situation. I mean, it feels like ages ago since we last spoke. And right now we are, in the phase where we're looking and seeing things that our measures are having an effect, our sheltering in place and our social distancing. And we're looking ahead and thinking about how we can sustain this much longer. And then also what it's going to be like getting back out there. For some people, that's almost scarier than it was getting quarantined and staying at home. So that's kind of what we're dealing with now, I think, as a community and, with our mental health and what I'm seeing with patients and my own family and myself.
Exactly. And how are you guys doing? I know you have a few kids, so I'm sure it's crazy over there, but how are you all doing?
We're doing fine. We're doing fine. We're managing. It's got its crazy moments and its fun moments, and it's a crazy time, but we're doing well. And this is new for everybody. And when I work with folks, I in the clinic or in my virtual visits at Advantage Care, physicians, we're going through this together. So I obviously have experience as a mental health professional, but I bring my own personal experiences to the table in dealing with this when I'm working with my patients or clients.
Yeah, absolutely, and that's so helpful. And again, I know you're going through it as we were speaking about, so thank you for making some special time for us tonight for our show too, to help out our viewers. We get a lot of social media questions, obviously, as the days go on, so I wanted to get to this one because we were just kind of touching on it. You were. Ira wrote this on our Facebook page. Will the virus ever really be gone? Can life ever really go back to the way it was before Corona? It seems so scary to go back to full stadiums, full wedding halls. This whole thing has had a real toll on all of us. We were just talking about that, kind of like the future aspect. I mean, so much uncertainty. Yeah. I mean, I think there was sort of it was more of a uniform response that we all took and followed certain guidelines for getting into the place where we are now. And there will be guidelines for getting back into place, but I think it'll be a slower progression. And there will be some variability in how individuals deal with that. It's really moving back to a place of comfort with uncertainty and acceptance of the uncertainty that there always is. But now, of course, it's been slapped right in front of our face. And so how are we going to shift it back in the background so we can get on with our lives? And that's really a challenge. But nobody knows obviously what life will be like in the future, but we have experiences like this before. New York has been through lots of crazy crises in the past, as we remember, and we've come back stronger and differently. But and I expect we will, as individuals, with support, and as a community as well. Yeah, really as one, and kind of keeping that mentality, which kind of leads into our next social media question that we got. And I know a lot of people are feeling this way. This one coming in from Patricia, who just is saying, let's not be selfish in this crisis. Think of someone else besides yourself, bless someone else, be kind to someone else, and love someone else around you, not just your family, but someone else's too. And we're kind of in this phase, the weather's getting nice. There's been a lot of chatter about who's kind of letting go of some of the measures that we've gone through. I mean, people are impatient. It's been a long time. We've never dealt with anything like this. So there's kind of that trigger to seeing some people let go or not wear a mask or gather in groups, which makes you maybe feel even more nervous about the whole situation. How do you kind of delve through that?
Well, one of the things I try to remind people, and again, going through this myself, and as my wife reminds me, she also is a mental health professional. Our wearing masks is not just to protect ourselves or to protect other people from the virus, but it's to help make people feel safe and that they're being respected so that they don't have to worry about this out there in the world. So that's something that people should take into heart and into mind when they're going out there, that it's just how you are together in a community dealing with this. And I do think it's time gets warped in this. I mean, the sense of time and how long it's been. And then, I think we should be wary about how quickly we can, in some ways, forget about it. And because we want to, we want to move on from it, but we have to be careful. There are beautiful parts of seeing what happens with a community during these crises and how we can all work together. And that's kind of the piece that I hope we as individuals can tap into when we're continuing to deal with this, and just being conscious of, our part in the broader community.
Great point. Great point. And that's something we hopefully most of us can kind of grasp onto in those moments. As you mentioned, just think of that bigger picture and that community aspect. Thank you for that. Let's get to Betty. I know she is on the line. Betty, how are you? Oh, actually, we're waiting on getting her. But again, thank you for bringing that back up, because this whole thing has a mental aspect. We knew this from day one. I mean, it's a virus. You can't see it. It's not this physical, reaction. And we're seeing the numbers go up and now obviously down, thankfully. But for something that you can't see, we knew it was going to be mental, and just that physical act of wearing a mask, as you said, is just such a comfort for not only yourself but others, who are passing by you. So thanks for reinforcing that. And I think we do have Betty now, so let's get to her. Can you hear us?
Yes.
Amazing. How are you doing?
Not too good. Good sometimes.
Okay. That's okay. And I'm glad you called in. What's your question for Dr. Resnick?
Well, mentally, some days I'm crying and upset. I go to sleep. I wake up. I'm thinking this is a bad dream. I'm wondering when this is going to be over. I get very depressed. I'm depressed right now, and I cry. I have not been out the house in 2 months. I don't go out. My daughter goes to the store for me. But it's just the mental part. It's mentally depressing, and I like to know, what can I do about that?
Yeah, no, I mean, it's I think what you're experiencing, and maybe this is helpful for you, Betty, that is a common experience for us all, how we're dealing with this. Just being in isolation without that human connection, that's an important part of keeping your mood and keeping your sense of wellness. So when that's missing to a much greater extent, it's natural. It's a reaction that we can expect, and just knowing that you're having that's expected to some extent might go a little ways to helping you deal with that, and knowing that as the crisis unwinds and we begin to be able to make social connections in the future, that will be helpful. In the meantime, structuring your day. It's hard to do that within the confines of your home, but even little activities that you may have missed out on in the past or are finding joy in now, scheduling those in, taking breaks and doing one thing, whether it's cooking a new meal or trying a new restaurant or a new TV show. Structuring those things in is important. And having some self-compassion is another key. So those are some things I can recommend.
We're joined by Dr. Resnick tonight, talking all about mental health and that aspect of this whole pandemic, which is super important. And I'm so grateful that you're here to talk about that again with us. I know we have Roxanne on the line in Mill Basin. Roxanne, can you hear us?
Yes, I can.
Awesome. How are you doing tonight?
I'm okay.
Okay. What's your question?
Okay, I have two questions for the doctor. My first question is, if you're feeling anxious, can't sleep, and just thinking about the whole virus, what can you do?
I think the first thing to try to do is, it always comes down to my recommendation to seek some help and someone to support you in that, because it's hard for me to give you some tips in just 30 seconds. But, I think the first thing is what we call sleep hygiene, and just making sure that you are only using your bed for sleep, and because now that we're confined to our homes, we may be using our bed for other things, even lying in bed to rest during the day or watch TV or read a book. And then it becomes a place not just for sleep. Maybe take a warm bath or shower, whatever you can do to soothe and calm your mind before bed can be helpful. Keeping your room cool, getting rid of cues like clocks next to your bed, that's all normal sleep hygiene. But beyond that, getting some, this is one of the things that, psychotherapy, mental health support can help you with. At Advantage Care Physicians, we're offering that virtually, as well as now, if it's needed, to be in the office, so that we can continue helping folks even while we're remote. And, there are plenty of resources online to be able to access virtual telehealth care, so you can talk to a doctor from the comfort of your home, and then you would get some help with that. There's also possible medication if it's needed to help you with that, but it's about anxiety and trying to be able to shut your mind off from that anxiety that's swirling around in your mind, and a professional can help you work on those thoughts. And medication could also potentially be helpful. So I would encourage you to if it's going on for a long time, sleep is so important. If you're not getting your sleep, it can change your whole physical well-being. So it's important to try to take care of that and talk to your doctor, and your doctor can help you, perhaps refer you to a mental health professional to get you further support on that issue.
And Dr. Resnick, have you seen more people kind of signing up for these virtual visits? I mean, I'm sure there's been more people kind of reaching out for this kind of help during this time.
Yes.
Yeah.
Most certainly. I mean, we have a steady flow of folks who were helping and dealing with the things they had been dealing with before, and now finding new challenges in how they're dealing with those things. And then, yes, of course, dealing with, COVID-related anxiety, if you will. People who've in particular had past trauma or past losses, this time can be hard because this is also a traumatic time.
Yeah.
This is a shock to the system. It's a huge change for everybody, and it's frightening, like you've talked about, in terms of thinking about what's life going to be like after all of this is done. So yes, we are seeing people reach out, and fortunately, at Advantage Care Physicians, we're able to continue to help the folks in the same way as we were before. And deal with their chronic conditions that are that may have been there even prior to this crisis.
Yeah, just encouraging to hear that.
Your health.
Yeah, that other and more people are now reaching out. I know we have Digna on the line in the Bronx. Digna, how are you? What's your question?
My question is that can you hear me?
Yep.
I just started a treatment for Hep C. I was a frontline worker, and I just wanted to know what are my status with this coronavirus and all this, because I'm very depressed. My husband's disabled, and I get up, I just don't want to open my eyes no more. I'm very depressed. So I just wanted to know if there was a combination of everything, the medication and everything that's going on.
I'm so sorry. I could hear some of your response, and I really want to make sure that you get the help you need. You should reach out to your doctor. There are helplines to get you help for your. There's a New York State COVID emotional support crisis line. You can also call NYC Well. I couldn't hear what you said in the beginning if it was about headspace, but there are different ways of getting some help with. Your mood. It's a real struggle. I feel for you, and we're here for you. So, I encourage you to get that mental health support. I'm just going to say this is Mental Health Awareness Month, so
Yes.
It's important that we all recognize the mental health piece as part of our whole wellness. That's key there.
It is key, and especially being an essential worker, Digna, like so many. I mean, having to deal with the stress of getting up and going to work every day still throughout all of this, in addition to what else might be going on underneath the surface, especially in your mind and in your heart, all the emotions as well. So we get that, and thank you for calling in. And even just expressing that, I feel like, is a lot of times step one. Even if you don't like speaking to other people all the time about what's going through your head, the fact that you called in is just encouraging, and you're clearly on that route to speaking with someone about it. So thank you for calling in. Thank you again to Dr. Resnick, and we're going to be right back. Stay with us. In and expressing your concerns and what's going on in your mind throughout all of this. Dr. Resnick, thank you for your insight as always. And I know you wanted to end on a couple things for our viewers tonight.
Sure. Yeah, I missed some of what the last caller was saying. I didn't realize that until the end that she was an essential worker. And my heart goes out. Obviously, they are helping all of us. And so it's important that we all pay attention to them and provide them with support. Long after this is done, there's the risk for post-traumatic stress, which happens after the crisis. And so we need to make sure that as a community that we're there for the mental health workers, and that the essential workers, and that the healthcare workers are getting the help they need. It's so important. And it's hard to also sometimes find the care, especially when you're in your home. So some of the things you can do on your own, in addition to just structuring your day. Also, even if you've never tried it, meditation can be very helpful as a way of conducting self-care. And there are even ways that beginners can use apps online. There's Headspace. That is a common app that's free for New Yorkers. So those are some of the things I would encourage you to do. And also just think of the growth that you have through this crisis. That's an important piece to take away as well.
Thank you so much for all those reminders. I know I need to take some of that advice as well. Thank you for being with us, Dr. Resnick. We'll see you soon, and be well, everyone.